Hiberix Vial is a vaccine that helps protect young children from Haemophilus influenza type B, HIB, infection, which is a bacterial infection that can cause serious illness, including brain infection, meningitis. Children younger than age 5 are at highest risk for infection. Vaccination is the best way to protect against this life-threatening disease. This vaccine works by causing the body to produce its own protection, antibodies. It is not usually used by children over the age of 4 or in adults. The recommended daily dosage and optimal timing for taking this vaccine should be discussed with a healthcare professional. Before receiving the Hiberix vaccine, it's important to read all the information provided by your healthcare professional. The vaccine is given as an injection into a muscle, usually in the upper thigh for young children and in the upper arm for older children. It's crucial to complete the full series of injections to ensure maximum protection. Make sure to follow the vaccination schedule provided by your healthcare professional and keep all scheduled medical appointments. The Hiberix vaccine can be given at the same time as other childhood vaccinations, such as diphtheria, tetanus, pertussis, hepatitis, and polio. Be sure to discuss the risks and benefits of vaccination with your healthcare professional. Some common side effects of Hiberix Vial include pain, swelling, and redness at the injection site, as well as drowsiness, irritability/crying, loss of appetite, diarrhea, fever, or vomiting. If any of these effects persist or worsen, it's important to notify your healthcare professional promptly. Rarely, some people may experience symptoms such as fainting, dizziness, vision changes, or ringing in the ears right after receiving a vaccine injection. If your child experiences any of these symptoms, it's important to tell the healthcare professional right away. Sitting or lying down may help, as these symptoms usually don't last long. It's important to remember that this medication has been prescribed because the healthcare professional has determined that the benefits to your child outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. Seek medical help immediately if your child experiences any very serious side effects, such as little or no response to touch, weak/floppy muscles. While very serious allergic reactions to this drug are rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your healthcare professional if you notice any other effects not listed above. If you have concerns about side effects, you can report them to the appropriate agency in your country. In the US, you may report side effects to the Vaccine Adverse Event Reporting System, VAERS, at 1-800-822-7967, and in Canada, you may call the Vaccine Safety Section at Public Health Agency of Canada at 1-866-844-0018. Before your child receives the Hiberix Vial vaccination, make sure to tell the healthcare professional if your child is allergic to it or any other vaccines, or if your child has any other allergies. This vaccine may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to discuss this with your healthcare professional. Also, be sure to let your healthcare professional know your child's medical history, especially if they have had a high fever, moderate/severe acute illness, a history of Guillain-Barré syndrome, or immune system disorders. If your child has Hodgkin's disease, they should receive the vaccine at least 10 to 14 days before beginning treatment or wait at least 3 months after chemotherapy is stopped. It's important to note that this vaccine is not recommended for use during pregnancy and is not usually used by adults. If you are breastfeeding, consult your healthcare professional before receiving this vaccine as it is unknown if the vaccine passes into breast milk. It's important to be aware of potential drug interactions with Hiberix Vial as they can impact how the vaccine works or increase the risk of serious side effects. Be sure to keep a list of all the medications and herbal products you use and share it with your healthcare professional. Don't make any changes to your medication dosage without consulting your doctor. Some products that may interact with this vaccine include drugs that weaken the immune system, such as cyclosporin and corticosteroids. It's also important to note that this vaccine may interfere with certain lab tests, so make sure to inform lab personnel and your child's healthcare professionals if your child has recently been vaccinated. Hiberix Vial is a vaccine used to help prevent infection caused by Haemophilus influenza type B bacteria. This bacteria can cause serious illness, including meningitis, pneumonia, and epiglottitis. Hiberix is usually given to infants and young children, but may also be recommended for older individuals with certain medical conditions. The vaccine works by exposing the body to a small dose of the bacteria, which helps the immune system develop protection against future infections. The usual schedule for Hiberix vaccination is 2, 4, and 12 to 15 months of age. It is administered as an injection by a healthcare professional. Remember to follow the dosing schedule recommended by your healthcare provider for best results. When it comes to treating the pain and fever caused by the Hiberix Vial vaccine, your healthcare professional may recommend using acetaminophen temporarily. It's important to discuss the best vaccination options for your child based on their age, vaccination history, and previous reactions to vaccines. Even if your child has had a HIV infection in the past, it doesn't guarantee protection against future infections, so it's still important to follow your healthcare professional's recommendation to receive the Hiberix Vial vaccine. Always consult with your healthcare professional before making any decisions about vaccinations. Be sure to keep track of when your child received the Hiberix Vial vaccination so that they stay on schedule for their immunization. This vaccination helps protect against serious diseases caused by Haemophilus influenza type B bacteria, such as meningitis and pneumonia. The usual dosage is 0.5 milliliters injected into the muscle. The optimal timing for this vaccination is determined by your healthcare professional. It's important to store Hiberix Vial in the refrigerator, but be sure not to freeze it. Also, make sure to protect it from light and keep it out of reach of children and pets. When you no longer need Hiberix Vial or it has expired, it's important to dispose of it properly. You should not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for the best way to discard it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.